can set them right there. Thank you. So, how are we feeling today? Let me take off some of these restraints. I assume that we're not going to be needing them at this moment. Just give me a little head nod. Great. So, I'm sorry about these, but it does appear that you have been a bit more aggressive as of late. And we certainly just cannot have that type of behavior at this facility. It's just not going to be tolerated. There. How does that feel? Much better, I know. Now, strictly, restraints are obviously a precaution for myself, but mostly yourself and the other patients that we have here. Due to your recent outbursts, I more so have decided to give you a review a little bit earlier than I thought necessary this last time. Yes. So, let's see. Now, I know that you came to us not that long ago. I, however, have yet to see much, if any, progress from you, and I will say that that is quite disappointing, as well as disheartening. So, Mr. Cooper tells me that you had a bit of an episode the other day before, or should I say during, one of your treatments. Would you like to talk about that? Well, if you're having trouble recalling, it was during your hydrotherapy, and Mr. Cooper says, and I'll quote him, "As we tried to lower the patient into the cooling bath, they aggressively began to thrash and pull away from us. I lost my grip on the patient, and during that time, they grabbed Miss Fisher, I'm sure you know her, about the neck, saying, 'I'm gonna kill her. If you come any closer, I swear it, I'll kill her.'" This is unacceptable. Now, luckily for both you and this facility, and especially Miss Fisher, she had an emergency sedative on her. I just have to say, our staff is here to help you. They are not here to inflict any sort of pain on you. They are not here to have an opinion about whether these treatments are working or not working. They are here to serve a purpose of function, simply to administer things that I require, that I obviously cannot do to every patient myself. And for you to be so aggressive towards staff is simply wrong. And that's all there is to it. Now, were you planning on killing Miss Fisher? Truly, were you planning on that? You didn't want to. You didn't. Is that all you have to say for yourself? You didn't want to kill Miss Fisher, so are you telling me that had circumstances gone differently and that you not given a sedative would have potentially fatally wounded Miss Fisher? Is that what you're telling me right now? Well, she certainly wouldn't deserve that. And you would have, quite frankly, unjust reasons for being that violent towards someone who is just doing their duty as a nurse. Now, this is the reason why we have you partially in restraints today, which I'm sure, obviously, you can understand that. However, I'm just going to let you know that this is not going to stop your treatments. Your hydrotherapy certainly will continue. However, due to this latest outburst on your behalf, you are going to be restrained throughout the process. It's not something that I want to do. It is not something that I enjoy doing, but, obviously you've left me no choice. And, as I'm sure you know, when you leave someone with no choice, you leave yourself with no options. Now, I've also been told that you have been refusing all of your meals for the last 2 days. How about we talk about that a little bit? What exactly do you believe is the purpose or the goal there? Interesting. You want to protest treatments of patients? Just yourself or for all patients involved? Well, I can tell you that the only thing that you're really protesting there is your own well-being. Quite frankly, here we are in the understanding that healthy bodies lead to healthy minds. Now, I'm not sure where this belief that if you don't eat your meals as we require and as your body deems necessary, that you will somehow miraculously be cured. And whether you're doing this for protest or not, sadly has no bearing on the future of your treatments. It, again, only makes us have to restrict your allowances a little bit more. And because of this, and because of this last disruption, all of your meals are going to now, I think, for the best and for the time being, be assisted. And you will have to be restrained. Now, I would hope that after this discussion, you would take some time to rethink this argument on your behalf, this protest of yours, whatever it is that you are telling yourself there, because you will be given the proper nutrients every day. Now, I would hope that you would allow that to be administered to you as painlessly as possible, but due to your recent activity and your growing aggression with the staff and everything, essentially, we will forcibly administer that to you if required, but, I would assume that you would have at least enough intelligence to understand that this is for your personal benefit to do as we ask. All right, now, outside of those two events, just as far as your daily progression goes, I have been noticing that you are still having night terrors. It seems every night so far since your last audio imprint sessions had ended, which was about 3 months ago now. These nightly terrors are a fairly common side effect from these audio imprints. It's still a tricky process. It doesn't work for everybody exactly the same way, and it's not always sure how each individual is going to react to them. Some take it better, some don't take it at all. It seems, however, that you are not progressing as much as I would have hoped given those imprint sessions. Now, I'm assuming because you're probably not getting the appropriate REM sleep as I would have hoped or liked, that maybe that's causing some of this stir and aggressive behavior. Now, I will say that recently we found some contraband items in your possession, which I know coming in we explain what is and isn't allowed. But, however, I do understand that because people come in various states of mental capabilities, that sometimes these things get overlooked. However, we do take these quite seriously. And honestly, not following those rules can cause a large disruption in your mental health. So we do have these rules in place to mostly keep your mental state safe. As much of the time, we have to damage it in order to fix it. So the things that we have taken, one, is this Rubaiyat. Now, I'm not sure whether you came in with this. I feel as if it would be something that would certainly be noticed. I would hope it would be noticed, but it has all manner of quite nightmarish imagery in it, some of which I can't help but think might contribute to some of your night terrors. Now, I'm not sure how often you read these. Alright, well, you don't have to tell me, but either way, you will not be reading them any longer. I mean, the images in here clearly can be quite vulgar as well, and I think are probably more disrupting to your mental state than probably a lot of our treatments are. So I would ask that you no longer try to obtain this kind of lewd material, and if you do currently have any other items like this in your possession, that you turn them over immediately, because you will be certainly subject to daily checks of your room now that we have found these items therein. We also noticed, well, at least the orderlies noticed and turned over to me, that you have a number of images of family and friends doing various things. And certainly I understand the idea that these would give you some sort of, comfort in your times of stress, your moments of sadness, maybe trying to give you something to look forward to or someone to look to. However, part of being here is trusting the process that we have set out for you. As I said before, here we often need to break down the brain a bit, in the sense of we need to deconstruct who you are or who you believe you are when you arrive here. Sometimes going back as far as infancy, with where we take the mind to give ourselves a completely clean slate. We want to start anew, so any sort of items like the ones you have had in your possession can disrupt that whole process. Depending on the treatments that we're doing, things like photographs of family members can sometimes stir unwanted emotions or memories that we're trying to actually remove. They cause a bit more chaos and unnecessary distraction within the mind when we are trying to get you just the building blocks of a healthy person once more. And the book, I just simply cannot tell you how disappointed I am that you are in possession of such illicit material when we are going through a healing process of sorts. We want to ensure that throughout this whole process that one such as yourself can fully distinguish the difference between, obviously, reality and fantasy, which you have there, and, materials such as that can oftentimes blend those two to the point where you no longer know the difference. So I would ask that from now on, anytime you do want any sort of reading material or entertainment of that nature, that you choose only from the selection that has been provided to you in our on-site library. So, quite frankly, I have to ask, do you want to get better? Because with everything taken into account that I've presented you with today, to me, it does not feel that way. I want you to know that it does not bring me pleasure or satisfaction to see others in discomfort, to see the pain on people's faces when administering these treatments. However, I allow them because I have the understanding that after comes a cure. It's a new beginning for that individual, something that many people cannot afford in life or have the opportunity to get a second chance. And you would think someone would be grateful for such an opportunity, although it appears that you have taken just the opposite stance. And I would also like to give you something to ruminate on. Don't think of our rules as some sort of forced punishment on you. Think of them more like walls of a well-built house. Something that gives you structure, gives you order, keeps you protected and safe from everything beyond. Because beyond that is chaos. It's wild. It's aggressive. And full of danger. And here, we put those rules and guidelines in order to give you structure, to keep you safe, to ensure that you are on the best possible path to your healing process, and nothing is going to be beyond our control. However, some people do choose to look at that negatively, and it appears that it's a stance that you have currently taken, but I would suggest trying to restructure that thinking of yours. It can be quite dangerous. You have a lot of opportunity here, but if you don't take any of it, then I don't know what exactly you're doing here in the first place. And as well as I can also assure you that any disruption to our process of healing is only going to extend your time here with us. So, something to think about. Given all of this, I need to provide you with a recommendation as what to do now with you. And certainly you're going to fight me on all of it. But I believe that I'm going to recommend you that we start electroshock sessions, as well as I think we need to administer those at least 3 times a week in between your sleep sessions, which we will be giving you audio imprints yet again. It seems that I should have maintained those a bit longer than I did. I've already told you that your meals will be administered forcefully now if we're going to be keeping you within a sleep state for the majority of the week, only waking you to do your electroshock. So no more arguments there, and hopefully by the time that you do come around to change, that you will not be fighting us anymore on that. Also, to ensure that your body and mind are stimulated, we will continue at least 1 session of hydrotherapy to start in the beginning, at least once a week, probably during the weekend. And we will just continue your prescribed drugs and doses as we have been. You know, I really did not want to have to administer such harsh treatments for you, but you know, it seems that you really just have given me no other option. Clearly you're a more severe case than I initially thought. Mr. Cooper will assist you back to your room now, but I do want to leave you with this thought, that if you truly desire to escape from here so much that you're willing to fight and injure and disrupt yourself and everyone else so much, the quickest way for you to get through those front doors and onto a normal life is to work with the treatments given and not against them.